are going to get right in. I've got to say, this is a family affair. It's not a Jackson webinar. If a child doesn't sneak in, you're supposed to be with Daddy, so run to Daddy.
I know. I'm praying mine don't wake up.
It's a good thing that our topic is families, right?
Yes.
So this is my number one of 3.5. I say 3.5 because number 4 is coming in June. But I breastfed her and transitioned to solids, and the other 2 as well. And I'm planning for number 3. So really tonight's webinar is just personally right on target of things that I want to learn. But I want to introduce you to our experts. Okay, please go to Daddy. Thank you.
Bye.
There you go. Family affair, guys. So let me introduce you first to Dr. Sharon Burbelo.
Hi, everybody.
We're
Nice
so
to be
glad
back.
you're here. You've been back with us. You're a
excited.
returning guest. So we're so glad you're back. She has been the maternal fetal medicine liaison for the Women's Hospital at Jackson for 4 years. She passed her RN board soon after graduating from Marymount College. And then she received her master's degree and PhD from the College of Nursing at the University of Rhode Island. And over her 45-year career, she has had the privilege of working with families from all around the world. I mean, you're only 47, so you've just been doing this since you were a toddler. And as the maternal family health liaison at the Women's Hospital, she provides education to new families, and she specializes in these areas such as newborn safety and safe sleep. She was with us for a safe sleep webinar, so you can go back and listen to that on jacksonevents.org. But Sharon, welcome back. We're so glad you're here.
I'm so happy to be here, especially talking about our favorite subjects.
That's right. That's right. We're going to get into it tonight. And I hope that our guests, all of these mamas with little babies, have come with all sorts of questions. We have so many questions for you. So thanks for joining us. And I want to introduce you to Jenny Rodriguez Anzoategui. I'm not sure that I might have butchered it, but
no, all
she
good.
is a licensed pediatric bilingual SLP, so a speech language pathologist. And she is at the Christine E. Lynn Rehab Center for the Miami Project to Cure Paralysis at UHealth Jackson Memorial. And she received her master's degree from Temple University in 2007, her bachelor's from UF in 2005. And she has served as a medical SLP for more than 14 years in pediatric hospital-based settings. So she has clinical specialties in bilingual language, phonological development, as well as pediatric feeding disorders. And she currently conducts evals, treatments for speech and language disorders, feeding and swallowing disorders in both acute inpatient care and outpatient settings. So she not only has an extensive experience working in a variety of different patients and diagnosis, but she's also a mom. And so she's a mom of 2. So I always say, I think, a lot qualifies all of our experts, but you're also moms and grandmoms. So you've got that experience to speak to all that you have to offer tonight. So thank you for joining us.
Thank you so much for inviting me. And thank you for doing this with me, Sharon.
And I want to remind our guests, you can utilize the Q&A feature at the bottom of your screen anytime. Drop a question there, and I will do my best to get it in front of our experts. But I'm excited because tonight we have a little bit something special. We don't always do this, but tonight, one of our guests, I hope she's listening in, but Dr. Lynn Rodriguez, she actually used to work at Jackson. She delivered all her babies at Jackson. I think Sharon's like, I know her. So she is wonderful. She's a mom in our community. We just connected via what we do with Miami Mom Collective, but she has written a beautiful, and when I say beautiful, I mean beautiful, effective, filled with amazing wisdom and knowledge, but I don't know if you can see it. It's called Homemade Baby.
Amazing.
So can you see it? Oh, it's so beautiful. It's hard with the digital background, but it is basically a cookbook and an educational resource, full color. It's so beautiful. I wish I could just flip all the pages and show you. But one of the things I love, look, there's some beans, some black beans, is it's Abuela approved. So there's all sorts of great Latin recipes, how to introduce, Latin foods that are cultural. This is so great. We're going to give one away. So thank you. There's Dr. Rodriguez. Thank you so much for popping in and saying, hey, you guys can find her on Instagram. She is at My Homemade Baby. So you can order the cookbook. You can learn from her. She has a nonprofit that's all about helping us introduce nutrition to our children. So she's doing great work. we're going to give away a cookbook just for hanging around. So someone tonight is going to get one. So hang around tonight. We'll announce at the end. But Dr. Rodriguez, thank you so much for sharing that. So we're so excited. Okay, let's dive right in. We got a lot of questions. Sharon, I want to start with you.
Okay.
How do we identify hunger cues in newborns and infants?
Well, believe it or not, that's pretty easy for the mom after she spends a short time with her baby, because you get to know your baby as you're spending time with them. And one of the things that you'll notice is that hunger cues occur when a baby is awake. So it's not happening when they're sleeping. And you'll notice that by just looking at the baby, they start to let you know through the cues that they're hungry because of hand movements, head movements, movements of the mouth, smacking, and all things that you'll very soon say, baby started to pull its hands out, starting to touch its face, starting to gnaw, starting to open the mouth. And that's a good sign that the baby wants to eat. So you'll feed your baby. That'll usually take care of it. So that's your younger baby, your infants and your newborns.
That's great. We're talking about from breastfeeding to solids. So let's just dive right in let's talk about breast milk and the guidelines. I'm about to be on baby number 4,
Yeah.
but I get confused. How long is it good? Do I put it in the fridge? How long can I save it? When do I dump it? All that. Give us some guidelines with how to use and conserve breast milk.
Sometimes I think of it as common sense, but everybody gets some different information. We have this fabulous bag that we give to our breastfeeding moms that our marketing department here at Jackson provides. It's an insulated bag. Awesome. And when I'm explaining to parents about the use of it, there is this freezer pack goes in the freezer, and they can put their breast milk in to take it somewhere or pump at work and bring it home. Anyway, one of the things that's included is a magnet that talks about how long breast milk is good depending on when you're storing it. This magnet has the 3s: 3 hours on the counter after you've pumped, 3 days in the refrigerator, and 3 months in the freezer.
Oh, that's good. I've never heard that. 333. I can remember that.
It's very conservative. Much of the research and the reading you do has bumped everything up to 4. Okay. So if you have a refrigerator that's 77 degrees or cooler, I'm sorry, a room, that's not your refrigerator. If your room is set at 77, you can leave your breast milk on the counter for 4 hours. Okay. Refrigerator, 4 days, freezer, 4 to 6 months. So that's a little less conservative, all thought of as safe. The bottom line is, if you swirl your milk around in the fridge or on the shelf, and it swirls nicely, no problems. If you see some chunks, for lack of a better word, probably shouldn't use it. Yeah. And it's a good idea to always smell everything too, Mom.
So we're smelling all the things.
Exactly. So that's really kind of your guideline. Again, we're conservative, but you can go a little bit longer.
Yeah, so that's good. Anything else you would add about storing it? I know I remember the first time mom, and I'm just dumping it in the bags, and I have this big, huge bag. And I'm like, what do I do? And then I learned the trick of like, lay it flat, and then you'll stack more and all that.
Right. In the beginning, don't freeze in large amounts. Use the bags that you can put it in and press the air out. Don't put large amounts. Your baby's taking 2 ounces, have a number of 2 ounces, and then increase in the amount as you go on. Always date and time, lay flat, like you said, and always have a plan living here in Florida. Okay. My son and his wife are doing some moving right now. And he said, Mom, I bought another freezer for Jess's breast milk. We're going to ship it the moving company's coming. They're going to pick the freezer up. We're going to ship it. I already set up the generator. They're going to plug it in as soon as they walk in. So the thought being is, if you're going to do any moving and you want to save it, the plans. The other is the hurricanes.
That's right.
You know, be
Power
thinking,
outages. Yeah.
always think, you know, who's got a generator, or how are you going to get this breast milk to somewhere safe?
That's good.
Mm.
I heard, this is just a little mom hack. This is a freebie, but I heard someone say to freeze like, you know, a penny or a nickel or something in some water. And then you see, like, then you know if your power went off while you were gone, maybe it came back on, everything refroze. And if that penny like falls to the bottom and it refreezes, you know that your power went off. And I thought, that's amazing, because sometimes you think, oh, everything's fine, you know? So
Great idea.
whole mom hack for you.
Cool. I'm gonna write that down.
Awesome. Okay, let's talk about, I just saw a question come through from our audience too. What should we do, or what can we do with breast milk that's left in the bottle when the baby finishes? Like, do we have to dump that? Can we save that?
Meaning the baby finishing and done eating, and that's the end of it?
Right.
Yes,
and there's some left over, you know?
Yes, that wouldn't be reused, and you'd wash your utensils. But if you're feeding and your baby wants to stop, burp, you want to spend some time walking around, and you come back to the bottle within a half hour, I feel that that's an okay thing to do.
Okay. Good. Within the half hour. That's good. Helpful. When we're breastfeeding, how can we tell if baby is actually hungry, or like maybe they're just soothing, you know?
That's a great question. And breastfeeding is good for both, for the baby that's hungry because they need nutrition, but sometimes it's a great place to soothe your baby. If a baby's hungry, you get a good latch. It's deep sucks. You watch the swallowing. You hear the gulping. I heard the gulping today in the recovery room, and this little baby was latched really well, and I couldn't believe it. But when she stopped with her latch, I checked her colostrum. It was her fourth baby. That baby was gulping because there was so much. A baby that's just nuzzling at the breast, pacifying itself, will just suck a little bit, is more looking for that soothing, and you won't feel that happening as far as the sucking goes. And that's an okay thing too.
Yeah. Okay. That's good. Helpful. What about, you know, let's talk about adding to the bottle. Like, can you add cereal to the bottle to give more calories, or like pureed food with breast milk? Like, at what point would you do that or not do that?
No food should be in a bottle, just the breast milk. Right, because that was done years ago, and everybody thought it made your baby sleep through the night, and it really didn't.
Yeah.
But we suggest, no, that's not a safe practice. Choking can occur, digestive problems. If your baby's ready for cereal, talk to your pediatrician. If it's before the 6th month, if you think they're ready, or if the abuela thinks they're ready, and your pediatrician can guide you with that. So
that's great. That's great. Thank you for that. Let's talk a little bit about weaning. I see, you know, someone in our audience too is like, oh, my son is 16 months and trying to wean him is so hard. So let's talk kind of maybe two bits to weaning in general, but also like weaning from pumping. Maybe some moms are pumping, they start pumping early on, and then they want to wean off of that. What are your strategies for maybe those two types of weaning?
Everything has to be gradual. Okay. When you stop breastfeeding or when you stop pumping, it's between the baby and the mom. There's no right answer. We're all different. We all do it at a different time. If it's appropriate for you, that's the right answer. But it has to be gradual. You might skip one pumping session a day, because we have a lot of moms that are strictly pumping. They don't put their baby to breast.
Right.
So maybe one, or you can start to shorten the times, or both. Gradual. That's what I mean. If you're uncomfortable and you think, oh, I can't take this, you don't have to do a full pumping session. You could take do a little manual expression. Little manual expression. Front to back here. Okay. And relieve your discomfort. Or you could use your handheld pump.
Yeah. Great.
And that's it. You don't want to go cold turkey. You run the risk of mastitis.
Nobody wants that. Yeah.
No.
Not fun. Great. Okay. So I mean, gradual, I hear that as the tip there, either for going off pumping or going off of weaning your baby as well. Circling back to, we talked about mixing things with the breast milk. So would you say no formula mixed in with breast milk too? A mom is asking.
Correct. If you have both formula and breast milk, always give the breast milk first.
Mm-hmm.
And then if you need to follow with formula, that's fine.
Okay, great. Awesome. One mom is asking that she's heard a difference between morning and night milk. So like maybe there's different hormones, or as you're freezing milk, like should you label it like, okay, I pumped this in the morning, or I pumped this at night?
We haven't found the need to do that. The difference usually is your greatest milk supply is in the morning, which is why when Jennifer talks to us more about introducing foods, it's best if you're a breastfed mom to start the foods in the afternoon, because the foods are thought of as a complement to breastfeeding as opposed to replacing it.
That's good.
So did I answer that question?
Yeah, I mean, it should be labeled a breast milk. Is it like, okay, I need to remember that I pumped this in the morning and I should give it only in the morning, or just give them the milk?
Right.
Yeah, that's great. Awesome. Another viewer asked, can you speak on is it lipase milk? Sorry, I'm not informed on that, but she said she didn't notice this with her son until past a year. Tastes horrible, but her son continued to nurse. She said, anything you would speak to about that?
I'm wondering, is she thinking that the milk was higher in fats?
Perhaps.
I don't know if she had a change in the way she was doing things or not. But usually, you're watching your baby, how your baby reacts, and, going from there, watching what their response is and continuing.
Awesome. Okay, go to your daddy. We're talking about breastfeeding. You go to daddy. Okay, we talked about hunger cues in our infants, but what about hunger cues from, let's say, 6 months and older, and then our toddlers? How does that transition and change?
That's the best, right? When all of a sudden they see food and they light up like Chris. Those are hunger cues. You have a 6-month-old that's kind of sitting and it's watching you eat, and they look very interested. And then your 1-year-old, might raise their finger and point to something. So they start to communicate with you. Those are their cues.
I remember, for a number of reasons, when they can start communicating, just things get easier in some ways, like the ear infections, when they can suddenly say, my ear hurts. You're like, oh, okay, we know what it is. It's so great. Circling back to the question about the milk, the mom who said she said the enzyme lipase sometimes affects the taste of milk. She said, so not necessarily higher in fat, but it was in the enzyme. It was higher in lipase. So
again, it's all the contents. You just have to kind of watch to see, what the baby likes or will to eat. Sometimes, again, things change and the baby doesn't want it.
Okay. Yeah. So just kind of monitor your baby and see how they do, right?
Correct.
Great questions, audience. Keep them coming. These are great. I just feel like this is such an opportunity to sit with experts. There's so often I think, I just want to sit with someone who knows all about this and ask all my questions. And I think I have the best job here because I get to ask all the questions. So any moms or caregivers who are listening in, if there's something you're thinking, drop it in that Q&A, and I'd love to get it in front of our experts here. So, okay, what happens to, I think sometimes the nervous thing of moms when we breastfeed is, what is going to happen to my supply when I start to introduce foods? And is there anything we should be doing to, keep our supply going?
Again, remember, it's a complement, the food. So to keep on a regular feeding, as you have been doing, feed as often if that's what your baby wants. Introducing later in the afternoon, later in the day, the foods in the beginning. Sometimes moms think they're more comfortable if they're pumping a little, and they hadn't been, because now the baby is eating a little more. So you're paying attention to your body with that.
Yeah.
So
that's great. Thank you. Sharon, that's great. I want to transition now to Jenny and ask kind of some questions related to her field. And of course, I might pull you back in here in a minute.
Perfect.
We'll have more questions coming in. But Jenny, let's talk about what are some signs of readiness for feeding solids to our infant, and when should we maybe hold off? Like, how can we know to tell the difference?
So typically you want to start around 6 months of age, right? That's like the gold standard according to the American Academy of Pediatrics, the World Health Organization, UNICEF, Family of Pediatricians. That's really what we're looking for. Now, there might be some variability among that. Your pediatrician may say around 4 months or 5 months to maybe start with some rice cereal. But again, really for a breastfed baby, we're looking at around 6 months.
That's great.
A couple things you want to look at. So a baby's tongue at the beginning, they have this like forward and back movement that we like to call anterior posterior movement, which is what they use to suckle from the breast or from the bottle. So around 6 months, a lot of things start to happen, right? They start becoming more alive. They're sitting up nicely. Now there's variability, right? So some may sit before others, but you're really looking at that movement is sort of going away. So therefore, it's a nice time to introduce a spoon, or if they're putting things in their mouth, so it won't come out. You're really looking that they're starting to get some more postural support and sitting up like around 6 months. Again, there's variability, but that's like usually the nice spot that you like to introduce a solid or what you're looking for, right? They might also be showing you signs of drooling, like a tooth eruption. Those are all good. Even though you don't need teeth to eat the solids, those gums are very, very strong, and we'll go over that. But those are readiness signs that you're looking for in the baby when you're ready to introduce the solid.
Awesome. I know there's some mamas listening in tonight who are getting close to that milestone. So glad that they have joined us.
That's the best age. I mean, I love the beginning, and I breastfed both my children, and it doesn't matter if you breastfeed or bottle feed, by the way. But for me, there's nothing like at 6 months, when they're really showing the signs and they watch you eat. And I mean, I'm also a jaded speech therapist, feeding therapist. I love watching kids eat, and I'm out all the time and staring at kids eating, but it's a very exciting time.
I love it. I know.
They start really
they start getting interested. Yeah. You're eating, and all of a sudden they notice that you're like, I've been eating for 6 months, but now you notice
outside, and they're interested, and it's very nice to see.
A sweet time for sure. Let's talk about how we can get our babies ready. So how can we get them ready for purees, for solids? Like, should we be doing some exercises with them, like pincer, trunk strength? What should we be working on?
So around the time that you should introduce, you're going to see them sitting more upright, right? So you want to make sure that you have them steady in a good high chair and sitting more of like a 90-degree angle, right? So you want their feet supported. I'm not a physical therapist, but I've worked with many over the years. So if there's any in there, I just want to make sure. But really for feeding, you want them nice and supported and sitting up. That's right before, when they're 4 months, 5 months, they're still working all that. You don't see that as well. But there's things you can get ready for even before that time. So let's say around 5 months, if they're really interested, I love to give babies like mashed avocado or celery sticks or carrot sticks. And it's not that they're going to eat it. And I know moms are listening to me like, wow, this girl's crazy. But they're teething, and you're going to really practice. So they're taking toys and things to their mouth. So all those pre-feeding skills, right? So for my first son, he was like my test. There's nothing that makes you a better therapist than having your own children.
That's right. Test everything on them.
So my first child, I really wanted to see what was the difference between the baby-led weaning and the purees, because I was doing a big talk with a dietitian at the end of the year. We were both pregnant at the same time. So I tried both. So at 5 months, what I did is really gave him like carrots and celery sticks. And all my patients that know me know that I'm big about that, because I rather teach them how to chew and start working on those skills with real food. Yeah. So here's a picture of my little guy. I don't know if you guys can see him.
Oh, yeah.
So this was my oldest, and I love this high chair. This is the IKEA Antelope high chair. The reason why I love this high chair, you got to be practical as a mom, right?
You can hose it down.
It's $19.
And it's $20. Yeah, I love it.
You take it outside with your Dawn dish soap, and you hose it down after. Your kids need to get messy. Yeah. And I know that was very difficult for my sensory husband to see that, but your kids, all of this beautiful, we're setting them up for success, right? Yeah. They have to get messy. They have to touch these things.
Great.
So this is a really good chair. The only thing that I can complain, and I'm sure that my physical therapist colleagues can agree, is that there's no footrest on it, right? To get that 90-degree. But there's so many companies on Instagram and baby goods that you can buy that nice footrest.
Oh, great.
So you want them set like this. So at the beginning, even before you really give them food to eat, like around 6 months, you can give them all the little carrots and celery sticks. So, and I would just cut everything big. They might not take it to their mouth, but also remember that they're teething, right? So cold celery is great.
Oh, yeah, that's good.
Now, I'm sorry, I didn't buy the longer, but I like the longer carrot sticks. Right?
Actual like carrots.
They're not going to break it off, so don't be concerned about
Okay.
any choking or anything. You're just building up those muscles and getting them ready for food.
That's
Also,
so
you
good.
can-
I didn't do that because it made me nervous. But hearing
Yeah.
from you, I'm like, okay, if we make them big, we can do this.
So then there's also like great little teething
Love that.
tools, right? So tummy time is super, super, super important. They need to grab, and they're grabbing their toys and all that, all pre-feeding skills, right? So every point of development is very important so we can get to the point of them being, walking, talking, eating by 12 months. So this is great because they can rub their gums with it and start working on it. So at 6 months, then you can already start either with a spoon and their first puree, or if you go the route of trying the baby-led weaning, giving them something mashed that they can, or not mashed, but more of a solid piece so they can take to their mouth. Yeah. But that, again, you'll see, those are all pre-feeding readiness skills.
That's great.
I know that was a lot of information for that question.
No, that was awesome.
Nice.
That was so awesome. I'm thinking of other questions as you're sharing.
No, go ahead.
On the topic of that, just semantics. When we say, from breastfeeding to solids, you're including purees in solids, right? We're basically talking about foods like beyond breast milk,
so
right?
The norm, I know that the new fad is the baby-led weaning, and I did a combination because I was not going to refuse my Cuban mother of not making my children puree, right?
That's right.
Or making them that nice thick mala. I was not going to divide, and of course I made it myself for them, and you put everything in it.
That's right.
And also I wanted them to get used to a spoon. So at 6 months, it's completely fine to give it to them with a spoon. You might see some of that spillage, right? Because remember what I told you, you're looking at that tongue placement. So they might not have the best grip, the lips over the spoon to move it back. It might be a little messy, but it's totally fine to give the puree. And then there's different stages of when you want to give things. And I always tell parents it's very important. You don't want to miss a step in the development. Because then what happens is we keep these kids on just breast milk or formula and their bottle and puree. And at 1, they're saying, oh my God, they're gagging and they don't want to eat anything. Well, we skipped a lot of you put the cart before the horse, right?
Oh, that's good.
So every single place, so at 6 months, you want to give the puree, but shortly after, by 7 to 8 months, you're starting to make those purees either like a lumpy solid, chunky, for example, a mashed banana, or some thicker oatmeal, so they can start getting that texture. You want to get them ready for that. And then you're going to go from that to a dissolvable solid. For example, the Gerber puffs or those dissolvable cracker sticks. And even though parents will tell me they don't have teeth, those gums are very strong. And those gums need that input, right? If they don't get that input, they're not going to develop. And also they need to masticate the food that helps the digestion system. If not, I have kids that are constipated. That all ties into that this isn't working well. Does that make sense?
Yeah.
So then when you transition to those dissolvable solids, then you can try the soft solids, like very boiled chicken, softer things. And eventually by a year, you're already at your harder solids.
That's good.
And then you wean off the puree and all that. I always tell parents, very important, I don't like mixed consistencies. I would avoid the Gerber stage 3 is a puree mixed with a solid. Very confusing for a child because they think they take it in their mouth and they say, am I going to swallow or am I going to chew? I would avoid that. That's usually a big red flag when parents are like, oh, but they do so bad on that and they're vomiting because it's a mixed consistency. So I say puree or solid, don't put them together.
Good tip.
Yes.
Great.
Actually, I took an excellent course when I started years ago. I would love to take it again. I'm sure by now there's more information, and it was by a feeding psychologist, and she was a consultant for Gerber.
Wow.
And she told them, you should take the stage 3 food out. Developmentally is not good for them. And Gerber said, that's our number one moneymaker. We won't.
Wow.
FYI.
Wow.
But I
Those
think
marketing departments are
it is.
concerned with all the developmental things.
It's very interesting because sometimes, I'll ask parents that say I do a feeding eval, and the parents are like, well, they're gagging on everything and they're 16 months and they're vomiting and they don't want to chew.
Mm-hmm.
But when I ask, I always, I feel like as a therapist, we're CIA agents, and you have to put, especially with feeding, it's a big puzzle, and I'm just putting all the pieces together. So when I ask, at what month did you introduce the dissolvable solids? No, I never did. So there you go. So it's really important to try to follow those stages of development, if that makes sense. And your pediatrician should, many pediatricians, mine used to have a guide that would say what to give, and you see your child and you feel your child out.
That's great. That's awesome. Yeah. Well, one of our guests even, spoke up, who's a dentist, and said, yeah, this is all so important. All the feeding things are so important, even from, like a pediatric dental standpoint of how it's helping develop all those muscles.
I refer to them all the time, especially all my lip and tongue tie patients. So I love my pediatric dentist.
That's great. When we were talking about baby-led weaning and the carrot sticks and the celery sticks, one mom asked, like, okay, what about babies that are teething and have a few teeth? Like, oh, should I be nervous they're going to bite the carrot? Like,
so that's when you're going to watch them more. So you have to be careful with that. But I feel there's a time and a place. So once my son already started getting that, he was already good with that type of solid. Like I knew the chewing was sort of in place and doing well. So I went to other things. Frozen bagels are great. Especially they want to gnaw on a frozen bagel. All of those things are great. But usually that's just at the beginning that you want to work out those muscles or the teething and get them ready and see how their pre-feeding skill is, right? So you're looking at
that pincer grasp was just as important as the
and the pincer comes a little later, right? They're a little sloppy at the beginning and little messes, but it's okay.
Oh, it's so fun. I don't know, talking about it kind of takes me back of like, oh, it's such a fun stage of like the baby years, It
is fun.
Seeing them explore the world and getting to lead them in that.
The feeding part is really fun.
Awesome. Jenny, talk to us about what are some good first foods to introduce, and what's the importance of offering foods, like you said, that are developmentally appropriate?
So it typically depends on your pediatrician. They'll say, let's say you're doing the purees, it's controversial, right? So sometimes they'll say start with vegetables, because if you start with the sweet, they're not going to like the vegetables down the line. I started with avocado. I figured that was safe, and I actually mixed it with breast milk. And initially I just let my kids both play with it. It's a great first food. And then even if you want to puree it, it's good as well. But there's no real rhyme or reason, but you can use either a vegetable. Typically we'll start with vegetables, and then you'll do a fruit puree, depending if you're doing puree. Now, if you're doing baby-led weaning, remember all the pieces, and I defer to the book. I defer to the Gil Rapley, and I forgot hold on, I have all my, Tracy Merkett. So they're the ones that did the baby-led weaning. I forget always the second author, sorry. I defer to them, and they talk really nicely about having long pieces of food. So, and the premise is that if the child picks it up and they mash it, whatever is coming through their little fingers is what's going into their mouths, right? So if they're mashing the banana or mashing the avocado, that's what's really going into their mouths. So that anything long like that, but anything, you're not going to give them popcorn. You're not going to give them anything they're going to choke on. You're looking at basic fruits and vegetables. Another big important thing. Oh, hold on one second. I lost you on my screen. Another big important thing, and I would defer to your pediatrician, is for allergies, right? About 50% of kids now are being born with food allergy, and I'm a food allergy mama myself with my oldest. You really want to give a food item alone. So if I did the avocado, I only did the avocado, and I waited 3 days. If there was no reaction, I'm looking for stools, skin, any of that, and I knew it was safe, then I would progress. Now, I would again defer to your pediatrician because that number may change. Some may say, I've had patients tell me 5 days, and I would also see if you have a family history of it. So
Okay.
just to be safe, right? That's very important. I always tell parents, especially with the rice cereal and the oatmeal, that they want to start it very young. I said, that gut's a little immature. Like, why don't we wait to the 6 months and then do one thing at a time and see.
Yeah, that's great. You were talking about avocado, and I just want to show, I'm like, I love this beautiful book from Dr. Rodriguez. But look at this. She has a whole, I don't know how to show you because my background,
it's so
but
great.
A whole page of like how to prepare. I mean, the background is driving me.
Oh, that's nice.
How to prepare the avocado, how to pick a good one, and then how to serve it to your baby. I just think this is so good. She goes through all
also.
Yeah, kind of
I have
sets
so many
like
patients that are underweight just by nature. And I always tell parents, like, add avocado to their food, put it in their smoothie. It's such a great healthy fat. Especially if the Florida ones are in season, right? And we can just get it from our trees, those big, beautiful ones.
Yep.
It's a great first food
so good.
that they can do. I also wanted to show that, I forgot that I had this. So
Yeah.
we were speaking about them chewing the carrot and the celery stick. I also love this. This is a bone safe feeder. There's other, you can use a mesh feeder, but I like this silicone one, right? So you open it and you put any food inside and they can practice chewing, and then they get the little pieces or the flavor of the food, right? So this is an also great tool that I like to use for my patients, or I tell my friends, or it's funny, my friends have kids and I buy them all feeding.
All the little gadgets.
Language gifts.
It's great hearing from the professionals of like, which gadgets do we really need? Like
there's a lot of stuff out there that I wouldn't buy, but there is a lot of good things out there.
For sure. Okay, we're throwing around the term baby-led weaning. We know what we mean, but can you define it a little bit more, maybe for a mom who's listening going, I've heard of it, but like, what is the difference? What does that mean?
Okay, so baby-led weaning is the premise that you're going to skip purees altogether. Or if you are going to give purees, you're going to let the baby feed him or herself. So the baby has complete autonomy, right? So you're going to put the food in front of them and they're going to dictate if they eat it or not. It has its pros and its cons, like everything, right?
Right.
It's very good in the sense of, like, let's say you take your child to a restaurant or anywhere, they're eating off your plate with time. Not that a 6-month-old is going to go to Ruth Chris and eat a steak with you. However, eventually that's the premise, is that they eat off your food. So they want to just teach the child how to eat by themselves, and they take control. So the also premise is that there's less gagging and choking involved because they have control of what goes in their mouth. So yes, initially they may gag and cough and parents get scared, but usually they take it out or they do it. And even if you're going to give them a puree or a yogurt, that they start to do it for themselves. So I have another example. This is my second that looks a lot like my first.
Oh, look how sweet.
He's probably around 6 or 7 months here, and I got him some really nice utensils, and he would just have at it and take it
to town.
So there's really good different things on the market out there. So these are called utensils and different things. You can give them a regular spoon. It doesn't really matter, but you buy them little ones or the cute ones, but so the premise is you're skipping purees altogether and you're giving them solids. I would defer to reading the whole book because there's a lot of information on there on how to do it and how to cut the food into strips and what foods to give first. And eventually, what I noticed as a feeding therapist, I know this isn't part of the question, but since I did it with both of my kids and I used my first one as my test dummy, my subject.
You're getting
my first one was my subject because I did both. We got to the same point, I think, had we done the purees or the solids. And you know why? Because I followed that developmental guideline that I spoke about. So at every month, I still gave him what he needed.
Yeah.
So there's no research that shows that the purees is better. Just doing purees or doing the baby-led weaning is better. I tell parents, you can just do purees, but still follow this guideline.
Okay.
So I'd give the soft solid at this age, give the dissolvable if your baby is ready, of course. But if you still follow that guideline, they both at around a year should be eating the solids. But there's the only research, and this is interesting if parents are me, because I'm very evidence-based practice and I love research and all things. Hold on, I had this printed out specifically if somebody had a question on it. Some of the benefits was a chance to experience different types of food. And then there is research showing that they're less picky as a toddler because they were exposed to so many things, which makes sense because purees are a mix of everything, right? So how do we know what they like, if they like garbanzo or whatever we put in there, as opposed to eating the whole real food?
Yeah. Makes sense.
So yeah, that's very interesting stuff on it, but there's no right or wrong.
Okay. Yeah.
Sometimes there's some kids that don't like puree altogether and they will just go to solid, and that's okay. I have many patients with GERD, with reflux, severe reflux, and a lot of them skip it altogether because that puree is associated with that burning sensation of the vomit.
Yeah.
So there's whatever is best for your child, you'll know as a mom, and always, defer to your pediatrician and tell them. That's good.
I feel like my second would have started with steak if we would have let him. He didn't, but they're all so different. That's what
they're all so different.
Where can we get a copy of that guideline? Is that like Academy of Pediatrics, or is there research you can share there?
Which one?
The one, the form you held up with the
this is from the lecture I gave that I made all the different things of what you should give at each stage. I made this myself.
Awesome. Well, maybe we can include it in the show notes.
Yeah. Maybe I can talk to Patty or see how we can send it out. But why I made this, because I gave a big lecture on baby-led weaning versus a puree with a dietitian. So we were both pregnant at the same time. Our kids were a week apart, and we did both. And then we wanted to give the perspective of, as professionals, therapists, and a dietitian, was there any advantage to one over the other?
Oh yeah, cool.
So the reason why I like this one is because I wrote about the age, the progression of what they should have, what oral motor skill they should have, right? So it goes line in line, and what developmental skill you're going to see, right? So, and this is more for my PTs and the OTs, so it all ties in together, the sitting, how it all aligns, sort of, more or less. But if this is something you're interested in, I can see if maybe Patty can email it to the participants. I'm more than happy to share that. But yeah, that's
definitely.
something.
Patty is saying that
not
we
made up.
Get
I
it.
just compiled it myself.
We'll get it in their hands. We can put together
Patty, I'm making you work extra, my friend.
That's great. No, I know. This is a great resource for her too. Okay. Also, that little gadget where you put the food in it and the silicone, is that like Amazon or Bye Bye Baby?
Amazon.
Find them wherever.
Amazon. There's different ones. The one that I like is Boon. Not that I get any money or marketing from these people. So I'm not a paid advertiser.
That's right.
But I like it because it's the silicone, right? Especially if a patient is already on a bottle. Sort of the same similar thing.
Oh yeah.
There's mesh feeders. There's a bunch of different ones, but I've liked this one, and most of my parents like it. You can also make breast milk pops. Those are my favorite, especially if you're breastfeeding, especially in the summer in Miami. It's fabulous. So you just buy a container as if you're gonna make popsicles, and then they can practice, and you freeze breast milk, right? So great for teething, great for moving their tongue side to side. It's really nice, like a good treat for them.
Wonderful. Let's talk about on the puree side and baby foods. One mom is asking, are there brands of baby food that you recommend? There's a lot of hype and talk about things are being recalled, or there's metals in this brand and that brand. It's kind of like hard to navigate. Anything.
So I'm going to talk to you as a therapist, and I'm going to talk to you as a mom, right?
Perfect.
So I like to keep it real. I made a lot of my food. I would just steam it, and I would just puree it, and I would just buy a lot of vegetables. And then I'll never forget that one of my old colleagues told me, she's like, don't get him used to that, because let's say you're out and about and something happens and you have to give him something store-bought. And that always stayed with me. So I bought like Earth's Best, or whatever was out. Now I'm forgetting the names. How can I? Beech nuts,
Right.
Whatever was organic out there, I would buy the little jars
Little
sometimes. There's
pouches.
not one
Yeah.
better than the other. I think that's just preference. I think that it's better if you can make it, right? There's nothing
Yeah.
like just doing it. But to keep it real, it's very hard. Most moms are working. My kids lately have been eating a lot of bought food because I don't have time. It's hard to manage everything. So I wouldn't feel guilty if you don't make your own food. We're just trying to survive.
Yeah.
As long as your baby's eating and happy, it's good. So I don't think that there's any brand that's better, and it's super easy to make the food. What I would do is just boil
Whatever.
any vegetable, fruits, everything, and then I had a Vitamix. You don't have to have a Vitamix, just a good blender. And I would blend everything in there. And then before I would go to lumpy, remember I told you about those mixed consistency?
Right.
I would, like my Cuban mom, get a strainer and just go like that and make sure all the chunks and stuff are out. But if you don't have time, there's many brands. There's for yogurt, I would always buy the Yo Baby. Start plain.
Okay.
Don't get them used to a lot of sugar and flavors.
Yeah.
Eventually you can sweeten it. No honey before one, after.
That's
But
right.
you can sweeten it down the line. So plain yogurt is good. The Stonyfield brand, I like the Yo Baby brand. And it also just depends what your child will take. Either
That's
you make
great.
it or you buy it, either or. Sorry, I'm blanking on all the names. I just had
No,
a
it's so
baby
good.
and I'm
This is so
forgetting.
helpful. So good. So many questions. And I'm watching our time because I want to respect our guests as well as our
Go ahead.
experts. So maybe about like 10 more minutes, but we've got a lot of questions. So I'm going to keep lightning round firing them at you. Okay. One mom asked that her son doesn't pay much attention to food if it's in a bowl, but if it's on his little tray, then he's all about it. But nothing in the bowl. Like, is there something that she could be doing to help him with that?
So I let my kids, I know my husband hated this, but I would just put the food on the tray and I would just do a little buffet and let them pick and play. There's also bowls that are sold, and it's funny, I could get up and go to the kitchen and grab one, that they're like the wooden ones with compartments and they're the suction ones so that they can see things. But I wouldn't kill yourself if they don't like it in a bowl. It's fine however they want to take it. I know parents like to do it because they like to itemize and see the amounts that they're eating.
Right.
But if he'll take it get the IKEA high chair, let him get dirty. It's also good for sensory at the beginning.
Yeah.
So
That's so
it's
good.
okay.
That's so good. I found myself, I would put it on the plate or the bowl to see like, okay, this is how much. Cause then I would lose track when I just kept refilling the tray,
Yeah.
but then, okay, now I'm just going to dump it on the tray and like go to town. So
Yeah, they have
great.
fun like that too.
Okay. What about, I think you've talked a little bit about this and you've kind of hit on this, but how we can set our babies up for success when introducing purees and solids. And you mentioned one thing about, sometimes you can have picky toddlers because we maybe introduced all the things and they don't know what they even really like. One mom even asked, like, what are a few good things for a toddler to eat that is maybe picky?
Toddlers is a whole other thing. It's normal for them to go to that phase, right? Because they have autonomy, and now even it's normal. And I have a lot of patients and even my own kids that they were great feeders and they ate everything with the baby led weaning, but they got into the toddler years and they just want crunchy foods or goldfish or garbage. And that's okay. I tell parents just to keep introducing it. I worked with a fabulous behavioral psychology feeding specialist, and he told me the minimum you have to introduce something is 10 times.
Wow.
Even us, like, because sometimes we'll present it and they vomit or they just refuse it. Oh, they can't have it. You never give it to them again. But keep introducing it because you never know, and you have to give it enough times for them to try it. Yeah. I would tell the mom just to try everything, just to, and keep offering them food and try not to be a chef, right? Because we become little sous chefs, like, oh, this one likes this one, and this one I'm gonna make the PB&J. Try to make the same meal. I mean, unless there's an allergy or there's really a restrictive, and this is a whole other topic if it's really a picky feeder or a problem feeder. But that's a whole other unrelated topic. That's
maybe when you need an SLP to come in.
We can tackle that one another time.
That's great. It's such a good topic. I feel like we could do, again, we're talking about part 2. So we could do a whole part 2 to this and just talk about toddlers and eating. Speak to us about gagging and vomiting. When should we be worried? When do we need to stick the finger in, pull it out?
Okay, so gagging is normal. It's normal for them to gag because especially if they're doing the baby-led weaning, they're going to put things in the mouth. They're going to have that hypersensitive gag. And I always tell parents there's a big difference between gagging and choking. So choking, you're going to see you're not breathing. For the most part, if they're coughing, they'll get it out. Or if you hear it coughing or gagging, sometimes what happens if they're used to puree and then we give them a solid and they haven't had like that sensation I told you to the gums. When something goes midline in the middle and they swallow it back and they realize it's a texture that they didn't chew, that's when you see it.
Yeah.
So I always tell parents, even at the beginning, I like to put things on their molars. So then I show them. And with my patients, and especially with my own kids, I would eat with them all the time. And I always use the same cue: open, close, chew your food. And I make silly songs. And that's just me in therapy. And that's me in real life, just to mimic that, right? So they can see their mouth is opening and closing. But if you're going to give them on the spoon, let's say if it's a solid or something, try to put it on the side so that they know they have to use their gums to bring it back. Because when we eat, the front of your teeth are taking the bite of the food, right? That's your anterior bite. Then your tongue is moving that food side to side. You should see that, so that your molars or your gums at the time for the baby is doing like that up down pattern. And then when it's chewed up, then they launch it back in the best. So it's all little steps. So sometimes it just goes there and it goes straight back and they skipped all the steps.
Right. That makes sense.
But that's normal at the beginning. I wouldn't go and, it is normal to go in there and try to take it out. You'll see your child. I know the first one's scary, so it's hard to say, like, don't freak out, but you're going to freak out, especially when it's your own kid. I've seen mine choke a couple of times. There was one time that I used to always cut the mandarin oranges, those little cuties.
Yeah.
I would always cut them in half. And I was taking a course, and of course, my mother-in-law never helps me. But the one day she helps me, she comes here and she gives my oldest the full orange. And the moment I hear that kid, I did have to turn him around. And,
wow. Scary.
That's okay. But, it's different when it's your own kid.
And because the choking is such a silent thing. You kind of, if you haven't really seen it, you think
those grapes, I would avoid nuts, popcorn, peanuts, grapes. If you're gonna cut grapes is long and skinny. There's even OXO grape cutters that'll cut it if you want to be fancy. But I've seen a lot of horror stories and heard a lot of horror stories with things. Just be smart. If it's big pieces and they get control, I've noticed less of an issue. It's more when the parents are just, give them a bite, wait a minute, and don't rush it. Meals are 30 minutes. They don't have to be 5. Give them time, their breaks, let them drink water. If they're having solids, by the time they're having solids, it's a good time to introduce water. Not that they should replace milk by any means, but little sips in between, that's okay.
That's good. And don't walk away. I always think, because it is a silent thing. Never just, I'm going to walk to the bathroom real quick. I'll be right back.
Don't leave them unattended in the high chair.
It's scary.
My second was a Houdini, and I came back one day. I was like, he's fine. And then he's like standing on the high chair dancing. I was like, no. Also, just for safety purposes of feeding, and
that's right.
Don't leave them unattended. No.
And Sierra, now that things are opening up and we're getting back out into the community, we suggest that parents take a course.
Yes.
Do an infant CPR class that includes removing an obstructed airway object, etc. The more you know, the more comfortable you feel.
Yeah,
absolutely.
Oh, very good to take that. And I feel like when they're babies, there's one, right? But maybe again, when they start eating would be helpful as well.
Yep. Good idea.
That's great. Yeah, thanks. And there's so many options out there, and most of them I think are free. So find one, sign up. I'm sure the hospital offers them. I know fire departments offer them. So check that out. That's a great resource and skill to have. Okay, speak quickly. We're going to wrap up our time here, and then we're going to announce our giveaway winner.
Yay.
But talk to us quickly about introducing allergens like dairy, nuts, fish.
Just do it and wait 3 days. I'm not an allergist. I've worked with them very closely, and my oldest is a food allergy baby. So I would just give an allergen and wait 3 days. But again, defer to your doctor, because lately, I think it was even one of my patients recently said 5 days that the pediatrician told them. So I would just defer to them. But for me, and I'm always looking at everything. You're looking at eczema. You're looking at their eyes. You're looking at their stool. You're looking at vomit. Those are all little signs. They're breathing. Not to scare you, just as a therapist, I've seen so many patients with food allergies, and I have a food allergy son myself. So these are just little things that I've noticed.
Yeah.
But defer to your pediatrician.
That's so great. Yeah. And note too, those of you who are watching, that we have a whole episode coming up on allergies, navigating that on May 26th. So we're going to spend a whole hour.
Good.
It's great. Okay. Last thing, let's talk about weaning the baby off of the bottle, introducing a cup and a straw. Talk to us about that.
I tell parents around 6 months to give them water, not to drink a full thing, but just to start introducing water with a meal, right? And parents are like, oh, they can't they can't suck from a straw. If you can suck from a nipple, you can suck from a straw. They're not going to know at the beginning. And remember, you're looking at that tongue pattern. So when it starts going backwards, they should be able, or that reflex starts leaving, they should be able to suck from the straw. There are great straws that you can do. I always taught both my kids and my patients, I get a regular straw, McDonald's, and I always take I top it off and I put it in the mouth, and I let a little come out, and their face is open. And little by little, I hold the resistance, and they realize that it's coming out. So these are a couple bottles that I really, really like. This is the Munchkin weighted one, right? So the reason why I like it, if you have a bottle-fed baby, they're used to the milk going with them. So this has a little weight that will fall on the bottom. That's great. So they can get something. So, and it's not one of those straws. There's different types of straws, right? That they have to suck a little bit for it to come out, not a wide open nipple. You know how sometimes I like it. This is another one that I use in therapy, and I love it. It's called the honey bear cup. So the reason why I like the honey bear cup is very soft and malleable. Oh, cool. So you can press the little the bear's tummy, and the liquid will come out. So eventually they'll know if they suck. Today, I was so proud of one of my patients today, because we've been using the cup, and the mom's like, watch. And she was already doing it by herself, and it was really nice. So it's so nice.
I've never seen those. That's so cute. That looks like
because it's mostly used for therapy, but it is, you can buy them on Amazon as well. It's like the honey bear straw cup. So you press the little belly, and I've never seen a pink one, and I was buying I didn't have a lot of the stuff anymore, because now my kids are big and I have a toddler. But anyways, so I don't have his anymore, but I got another one, and I'm going to give it actually to some of my patients. So I got some extra, but I've never seen a pink one. So they have them in pink. And these are really nice stuff. There's a lot of, I would avoid a sippy cup with a spout, because by a year, you want to wean them off the bottle. Okay. And the reason why is then, and I'm sure there's the pediatric dentist is on there, you want to move them to a cup and a straw, because the bottle is going to have that nipple shape, and the teeth are forming, and you don't want that bottle shape, because then it starts affecting their dentition, their speech, in terms of that tongue thruster. They're going to get that. It's going to affect their swallow. Also pacifiers. I know, hot topic, but usually you want that and a bottle out of a year of age. Now, I know there's a fine line between what I'm telling you and your sanity. So you do it little by little. I'm not going to say cold turkey, because I know some moms are going to have my head, but those are things you want to look for. So if you start introducing this around 6 months, by a year, they should be okay, right? And they get so concerned of, they're not going to take the same amount of formula or milk. But remember, when they turn 1, they're on food, so they don't need the same amount. They need like 16 ounces of milk, and you can get it through cheese, through yogurt. So it's pretty easy to get that in a cup at that point, instead of being on a bottle, if that makes sense.
Yeah, that's good. Oh, I need to go. I've got a 16-month-old. We got to throw away the sippy cups, because I'm like, we just use whatever we can find the lid to, It's like, where's the cup?
Sorry, I'm the bearer of bad news, ladies, but Yes, try to get or dads if there's any dads on the chat.
Love
But
it.
usually no sippy cups because it's the same thing as the bottle.
Right.
The spout
Got you.
is pretty much the same. So I rather use open cup or straw. I'm a little
Awesome.
strict about that, but
Okay.
it's good.
That's great. Jenny and Sharon, thank you so much.
Oh,
This was
thank you.
so
Welcome.
helpful.
Thanks for coming, everyone.
Oh, good. I
Thank you
thank
so
you.
much
Yeah,
for
everyone for
listening.
listening in and asking great questions. I'm so excited. We're going to announce. So we've chosen a woman or an attendee, I guess, at random, and the winner of this beautiful cookbook, we're going to mail it to you. Lisette is going to mail it to you. Is Darcel Burgess. So Darcel,
Yay, Darcel.
you're going to get the homemade baby book. It's so beautiful. And again, you guys can find Lisette
Great.
at My
Okay.
Homemade Baby on Instagram and also on her website. You can order the book there. You'll want to order the book. If you're introducing solids, you'll want to order the book. Just go ahead and order the book. I have it and it is the best one that I've seen. So, but great. If Darcel, you'll just send us a private message with your email so we can connect with you and get all that to you. But thank you again, ladies, our wonderful experts tonight, Sharon and Jenny. Thanks for
Thanks, guys.
joining
Of
us.
course. Thank you so much
Great.
for having me. This was fun.
Yes.
Told ya.
Yes,
Yeah.
you were right, Sharon.
I want to draw your attention, everyone who's listening in, that we're going to be back in 2 weeks. So Thursday,
Okay.
May 12th, our next episode is all about cultivating emotional intelligence. So as a parent, we have a
That's great.
responsibility to encourage our children to develop academic intelligence, but their emotional intelligence is just as important. Emotional intelligence is the ability to express, to manage our feelings appropriately, while also respecting feelings of others. So huge, huge, huge life skill. And we're going to dive into that coming up here in 2 weeks. So on May 12th, you want to join us. It'll be 8 p.m. again for 1 hour. And here you may want to screenshot this. This is a great list of resources. Some of the things that our experts spoke about tonight. And we're going to pull together a tip sheet and we'll have Jenny send over that document that she made.
You got it.
And
Beautiful.
this webinar will be available on jacksonevents.org. Give us about a week to get it edited and up there. But visit jacksonevents.org if you haven't, because literally there are close to 30, maybe more than 30 webinars, some in Spanish, some in English, on topics, probably everything you can think about. So if there's a topic we haven't covered that you want us to cover, let us know and we will be on it. So these times together are just so insightful and helpful. So huge thank you to UHealth Jackson Children's Care and the whole team there. And again, Sharon and Jenny, thanks so much.
Thanks,
for your time
guys.
tonight.
Bye.